Chapter 30, the symptoms, diagnosis, and prognosis of prostatism. Symptoms. Inasmuch as prostatism causes no noteworthy symptoms until it produces retention of urine, the pathological changes in the prostate exist for years before the onset of symptoms, and the prostate may be much enlarged without provoking symptoms, so long as it does not cause retention. Thus, I have seen a man of 80 years of age with a prostate 4 times its normal size, whose attention had been only recently called to his urinary organs by the symptoms arising from a secondary stone in the bladder. The presence of prostatism does not imply the existence of symptoms. Furthermore, the small sclerotic prostate may cause all of the symptoms that arise from the large adenomatous prostate. Indeed, the sclerotic prostate is likely to cause trouble earlier in life, much more difficult to relieve by operation than its more familiar adenomatous fellow. The symptoms of prostatism are 1. Symptoms of retention, viz. Frequent urination, urinary toxemia. 2. Symptoms of infection, viz. Infection of the upper urinary tract, urinary septicemia, pyonephrosis, prostatic abscess, vesiculitis, epididymitis. 3. Hemorrhage. 4. Sexual symptoms. Symptoms of retention, nocturnal frequency of urination. This is almost invariably the first symptom of prostatism, even before there is any infection or notable retention of urine in the bladder. The patient has to arise several times at night to urinate. This irritation is usually most marked after 4 a.m. and doubtless is associated with that pelvic congestion which excites erections in younger men. Painful and difficult urination. During these hours of maximum frequency of urination, the patient recognizes an obstruction to the flow. He has to wait a long time for it to start. It comes in a feeble stream and is slow to stop. The more he strains, the less he is able to urinate, and he can often only empty his bladder by repetitious efforts. As the amount of residual urine increases or infection supervenes, urination becomes painful as well as difficult, frequent by day as well as by night. Acute retention of urine. As a result of overeating or drinking, exposure to cold and wet, or, above all, voluntary retention of urine against the call of nature, the prostate may become suddenly so congested as to excite spasm in the sphincter and acute complete retention of urine. This may be relieved spontaneously or by a hot bath, but usually requires the catheter. If neglected, it may kill the patient or leave him in a condition of overflow. Overflow. True incontinence of urine, i.e., the involuntary loss of urine without filling of the bladder, does not occur as the result of prostatism. The loss of urine that does occur is overflow from the chronically overdistended bladder. This overflow is usually associated with irritation of the bladder, so that the patient urinates whether he will or no at least once an hour, perhaps oftener, and between urinations, especially during the night, he loses urine involuntarily. Symptoms of changes in the upper urinary organs. As a result of infection and dilatation of the bladder and the kidneys, the patient suffers from urinary toxemia or urinary septicemia. His frequency of urination is increased by cystitis and stone in the bladder and by the polyuria of renal dilatation. Fever may be due to infection in the prostate, in the kidneys, pyonephrosis, or in the epididymes. Hemorrhage. Bleeding is much more common from prostatism than from prostatic carcinoma. The bleeding is due either to an ulceration on the surface of the prostate itself or to secondary stone in the bladder. It may be of that profuse quality so suggestive of malignant neoplasm. It may occur quite independently of the passage of instruments. Sexual symptoms. The combination of age and disease usually diminishes or obliterates sexual power and desire. Exceptionally, however, the congested prostate excites abnormal erections, which may drive the patient into neurasthenia or into all sorts of sexual excesses.